Hello and welcome to the TrueLessons overview of the OET Speaking Test. Now, the OET Speaking Test is not an interview between the examiner and the candidate, like asking general questions. It's very profession specific. That is, the interlocutor or the examiner will be sitting in front of you, and he or she will be doing the role play of a patient, and you in your professional capacity will have to respond and manage the patient's problems. So the OET speaking test is 2 role plays that you have to perform and manage in 20 minutes. One role play lasts for 10 minutes, approximately 10 minutes, and then you move on to the next role play. So there will be a role play card given to the examiner and one to you as a professional. You have to prepare your notes and read those notes and perform each and every task that is given here. For example, I will now display one role play card. This role play is for a nurse, and the interaction will be between a nurse and a patient, and my colleague and I will demonstrate how it is going to happen. So in this role play card, you as a nurse will have to advise the patient. So you have 5 minutes or less, little bit. You can prepare what you have to see. Remember, you will not know what is on the role play card of the examiner. So highlight all the issues that you will be talking about and prepare a few sentences that you could anticipate the examiner will ask you. So here, yes, you know this is a 52-year-old patient, but do mark that she is paranoid. So what does paranoia mean? That she will be very overexcited. She will push you back on any advice that you will be giving her, and she is very stressed because her social background is also given, where she is taking care of an uncle and aunt with extreme cases of multiple sclerosis and Parkinson's. So you can imagine the stress. So in this role play, what you have to keep in mind when you are preparing your answers is A, you have to console your patient. Be very patient with her because she will be telling you all her problems because she has a lot of stress. She is in pain and she does not want to try maybe new things. All this you must anticipate and prepare answers. At no point should you lose your composure, because even if your patient says, no, I will not try, or I'm too agitated, I can't afford, you have to always offer solutions. She might even say, I don't have time because I have a full-time job. Then also you have to take her personal condition and advise her on that as well. So you have to perform each and every task in this role play. Now, as I can see, there are about 7 tasks prescribed here, 7 or 8, and you have to take it one by one because you have to anticipate that the examiner will ask you these questions or act like a patient, and you have to answer all her queries. So we will begin the role play. My colleague and I will be enacting it in a brief manner, and we will see how we perform each and every task.
Good morning, Mrs. Jennings. I'm Ashlyn, the nurse for today. How can I help you?
Well, I have a lot of feet ache. I stand the whole day. I'm working as a customer service representative, and it's really tiring.
Oh, that's quite bad. Can you tell me for how long you've been having these aches?
Can't remember, maybe 6 months, 1 year. I can just say I was suffering for a very long time. And I found no relief, and now it's like I might have to quit my job. And that's why I've come to you, because I cannot stand and do any work anymore. I also want to tell you that I'm taking care of an uncle and an aunt who have got Parkinson's and multiple sclerosis, so it's very difficult for me.
It's quite bad that you're thinking of quitting a job. I don't think that will be necessary, Miss Jennings. Anyway, let me take a look at your feet and see what we can do about it. It could probably be that your long working hours are causing an effect on your leg valves, and that is why the blood supply is less. So that could be one of the reasons for your aching feet. It is also associated with the tingling and numbness. So I think that should cover it up. But still, let's see what can be done about your feet.
You know, it's tingling and numb, and I can't even feel it. So I can't walk anymore. So what should I do?
Well, I would like to suggest that you can try out compression stockings and orthopedic shoes, like the popular one,
No, I don't want any shoes and socks and all that. What are you saying? It's very difficult, and I really don't think shoes and socks will solve my problem. I want you to prescribe some medication or something. I've tried putting my feet in warm water, and that's more than enough.
I understand your apprehensions, Ms. Jennings, but with my experience, let me tell you that most of my patients have got relief with the compression stockings and orthopedic shoes. So I strongly suggest you go for the Dr. Wells shoes. I'm sure it's going to give you relief in the long run.
But what if it pains even more? Then what will I do?
Ms. Jennings, it will definitely ease out your aching pain, and the numbness will drastically reduce. I'm confident about that. Give it a try for let's say a couple of weeks, maybe 1 or 2 weeks. You give it a try, and then if it does not subside, then the next option is that I can take you to a podiatrist. I will fix an appointment with the podiatrist.
What is this, Ashlyn? I came to you for advice, and I thought you will give me something to take home, some medicine or something, but now you first said shoes, then you're saying podiatrist. I don't have even time, I have to rush back from work. So no, I don't want to try anything new.
Ms. Jennings, calm down. I'm here to help you out. Relax.
But you're not helping me.
Yes, so let's just chart out something.
You're telling me podiatrist, shoes, socks. I don't know now what you will suggest.
Yes, so let's go one step at a time, Ms. Jennings, right? Let's start with the compression stockings and the orthopedic shoes. If you are not finding any relief, then we can go for a podiatrist. Otherwise, there is no need for that kind of a thing. I'm sure you're tight on schedule and you're quite stressed. You have people to take care of at home. But the suggestions that I'm going to give you now, as of the compression stockings are, if you can follow it, it is really going to be helpful for you. And I'm quite confident it is going to help you in the long run. Why don't you give it a try? Shall I show you some websites that sell good stockings and orthopedic shoes?
Yeah, okay, but I don't know how to buy them or choose. Will you help me with that?
Definitely, Ms. Jennings. I'm here to help you out. Let us both go through the websites together, and I can make some suggestions. Whatever fits your budget and whatever color you choose, we can book those.
Okay. And I don't know anything about compression stockings because it sounds so dangerous, that word compression. Is it going to really give me relief?
Oh, it's definitely going to give you a relief, and I will, yes, help you out with which kind of compression stockings are best suited for your condition.
Okay, and then so I don't need to go to any podiatrist or anything like that.
Use it for 2 weeks, and in case the pain does not reduce or if the situation worsens, then I will book an appointment with the podiatrist. But I'm sure this will take care of your issue. So the first step is to use your compression stocking. In 2 weeks' time, I'm sure you will find an immediate relief to all these aches. In the meantime, I will book an appointment with a podiatrist who can give you.
For what? Why are you booking me with a podiatrist?
Well,
You're saying this will relieve me, right?
yes, this will definitely relieve you. But the podiatrist is our specialist here and is a very good doctor when it comes to these kind of aches and pains. And I want him to have a look at you so that he can give his expertise opinion on your condition. As far as I know, I do not see anything wrong with you, but still let us take a second opinion.
Okay, then you can suggest something to me, somebody to me.
Definitely. Dr. George here in our hospital is available after 2 weeks, so I will book one appointment with him.
Okay. So now there's nothing more to do or understand. So the next step is you're going to suggest the shoes and the socks and the podiatrist.
Right.
So is that all? Can I go?
Yes, I would also like to tell you that your condition is in no way associated with your aunt's or uncle's medical conditions. Do not overthink, Ms. Jennings.
Yeah, that is one of the things I don't sleep about because I'm 100% sure it's Parkinson's because for my aunt also it started like that.
Right, I understand how anxious you are, but please be assured that these are not interrelated and there is not a genetically transferred disease. So there is no sure shot way to tell whether it's this or not. But from the symptoms that I'm looking at, they are not connected to each other. Yours is just related to the stress, the long working hours that you have to spend at your customer service center. Ms. Jennings, one last word is that in case you face these kind of situations in future, do not stay at home and wait for it to worsen. Immediately seek medical help.
But you said that this will help me, right?
This will definitely help you and should take care of the issues. But still, just to be on the safer side, I would like to advise you, in case this occurs in future, do not stay back at home, rush to us immediately so that we can give you a quick relief.
So now you've seen how the candidate was faced with a difficult patient, slightly difficult patient, how she was calmed, she was reassured using the right phrases, and how the professional did not lose her cool or get annoyed with the patient for not listening to the professional and so on. So make sure that also all the tasks, there were 6 or 7 tasks, all of them were completed. So once you've done that, say thank you and the role play test will be over. If you like our video, please press the bell icon and subscribe to our channel and follow us on all our social media handles. Thank you.